All right, welcome back. So today we're going to be talking about a way to use your floss band to work on stiff knee. So this can either be caused by an issue with the tracking of the kneecap or an issue with your ability to bend the knee. So today we're going to be joined by Olivia. So we're going to work on unstiffening her knee. All right, so for starters, we're going to take our floss band. In this case, you're going to start above the knee. And basically, you're going to wrap from outside to in. So your first loop here is going to be almost no tension. And then as we come around, we want to go ahead and tension up and across. And then from there, just continue halfway down the remainder of the knee. This is where I speed it up on the video because we have to make it in under a minute for Instagram. Because Instagram is a little pissy like that.
Put on Instagram or Facebook?
Both. All right, so now if it happens to be our kneecap that is stiff, you're going to take your hand here, you're going to put it on the outside of your kneecap, and you're just going to ease it off the edge there. All right, so just enough pressure that the foot here moves along with your pressure, and it helps us know that we're in the right place. All right, so you're gonna take that for about 30 repetitions and then retest and see how that knee feels. All right, you can stop. I'm gonna keep on going. All right, so if we're dealing with issues getting depth in a squat, so we're gonna take the same floss band application as we did before. And now she's going to drop down into as deep of a squat as she can. Good. Go ahead and move forward just a little bit there. And try to rock back in as deep of a squat as you can. All right, so here this should be pain-free. And ideally we're going to go ahead and work about 15, 20 repetitions into that deep squat. Yep, keep going. There we go. And basically the floss band itself is going to work on opening up the knee joint, stretching the joint capsule there. Keep on going. As deep as we can. All right. Try to keep that weight symmetrical. And then, as always, once you've finished doing this, retest. Hi, and welcome to TallahasseePT.com, home of vitamin